There are still, of course, outstanding tests that were of the 75 that were taken yesterday. The rest of the young people there, the 127, will be tested, as well as staff. The Chief Health Officer will also outline an historic case that has been identified in this testing period and will be added to our probable cases count, and it relates to a known historic cluster.
So no new cases overnight, which is excellent, particularly all the work that was done yesterday at the Brisbane Youth Detention Centre, where 56 results have already come back and all of those have been negative. And of course, the vast majority of those were done on the children, the youth in the centre, so that is a good outcome. We'll continue to test all of the youth in that centre, plus all of the staff, and continue that process over the weekend. Now, we did have one new case overnight, a probable historic case. So these are one of those ones that are being picked up on serology. It's of no concern, and we can actually link it back to a known outbreak that occurred earlier on in the pandemic. So that just lets us know that we had more cases at that time when we had that large numbers, when we were getting those 80 or so cases every day, which is good that we're continuing to get that information come through. It's really, really important that people continue to come forward to be tested if they have any symptoms at all, any symptoms, no matter how mild. That is vitally important, and that you isolate yourself until you get the result of the test. Then we also must maintain social distancing. If anything, this last week has shown to us that we don't know when we might get the next case, and the best way to manage that is to manage social distancing. And we can see that in the Brisbane Youth Centre that they did have policies in place, and we'll see what the result of that is after having had a case in the centre. Hopefully with all of the policies, they were very rigorous policies, we won't get spread there. And we need to have that occur through every aspect of our lives. It's difficult, it's annoying, we all want to go back to normal. We can't yet until we've got this pandemic under control and we have an outcome with either a good effective treatment or a vaccine. Not that I'm aware of. At the moment, I'm waiting for the genomic sequencing of the virus that the lady has who worked in the centre and those young women who went down to Melbourne. I haven't got that genomic sequencing yet. I expect it in the next week.